What's up guys, Sean here. In this video, I'm going to show you a way to help relieve back pain. Now, if any of you have seen the videos before this, you've known that I recently had hernia surgery. And during my recovery, my back got really stiff, mostly as a result of sleeping more than usual, sitting more than usual. Also because during the first week I had a lot of pain on my side. I wasn't able to stand up completely straight, so my back was kind of in a compromised position. So as a result, I had a lot of stiffness, especially in the lower back near the lumbar region. So I'm going to show you a way to help relieve that pain. Now, I just want to point out that this isn't specific for people who have back pain post hernia surgery. You could also use this if you have back pain because you're sitting a lot from work or you just have a stiff back in general. Now, this technique is called myofascial release. And you're going to need one thing to do this. In this case, I'm going to use a lacrosse ball. Now, some of you who have done myofascial release before, you typically use a foam roller, which I'll show you in a second. It's basically this. But for the purpose of this video, I'm going to use a lacrosse ball, and you'll see why. It's because I'm using it on my lower back, which is what's sore. And the lacrosse ball works a lot better for that small muscle. So you're going to need either a lacrosse ball. In this case, I have it duct taped together like so. I'll explain why in a second. You can also use a tennis ball if you want. It actually has a little bit more give. Or you could also use a baseball if you're more advanced. I would suggest beginners to use either the lacrosse ball or the tennis ball because they have more give and it's not as painful. And I'm also going to have a link in the description below for some Amazon sellers that sells this. But you could buy this online or you could buy in your any local store if they sell lacrosse balls or tennis balls. So the way this works is I'm going to place this lacrosse ball near my lower back, which I'll show you in a second. And I'm just going to kind of roll out back and forth until I find a really sore area. And I'm going to keep it there. I'm going to keep the pressure there for about 15 to 30 seconds. Now the way this works is that pressure that I'm applying to that sore region, it's going to help relieve the tension in there. Alright, so what I have here is I have my yoga mat. The lacrosse ball's right here. And I'm basically going to lay on top of it. I'm going to place it basically where the middle of my lower back is. I'm just going to slowly lie down. Okay. And now the reason I duct tape the ball together instead of having a single one is because on your lower back there's basically two lines of muscle, one on the right side, one on the left side. The way I duct tape the two lacrosse balls together, it lays perfectly on those two lines of muscle. So as I'm rolling up and down, it basically hits those spots specifically. So I'm going to start from the bottom up. Okay. Now right here isn't too tight, so I'm going to basically adjust myself towards my feet just a little bit. The ball stays in place, so as I'm moving down, it's going to basically go higher up where my back is. So it was here. Now I'm shifting down. It's going to go a little bit higher. And right there, I'm pretty sore there. So I'm going to keep it there for about 15 to 30 seconds. And I'll just keep repeating that process. I'll just keep moving myself down. And as I do that, it's going to hit higher and higher up the back. So right here, if it's sore, you're going to do the same thing, 15 to 30 seconds. Just try to relax. It's going to hurt a bit, especially if it's first time, but that's fine. That means it's working. And you just keep repeating that process until you hit all the spots that are sore. And if you want, you could even move back up. That way you hit the spots a second time. And so on. So that's how you do myofascial release for your lower back. Now, as mentioned before, if you have sore muscles in other areas, such as, let's say, your hamstrings or your quads, you could use that same technique for those areas. You could also use a foam roll instead of a lacrosse ball, whatever makes you more comfortable. But for smaller muscles, I would suggest the lacrosse ball because it hits those areas a little better. I'm in the second week of my recovery post hernia surgery. So I'm able to do that technique without any pain really. If you're in your first week on the first few days after surgery, I would not suggest you do this technique the way I showed you in the video. I would suggest you do it leaning against the wall instead of laying on the floor. Because if you just had hernia surgery, that area is going to be really, really sore. And laying on the floor like that is probably going to hurt a lot. So I would suggest you do that technique, but leaning against the wall instead. At least until you feel a little better. So as usual, thank you for watching. I hope you found this video helpful. Any questions or comments, just leave them below. I'll try to answer them as soon as possible. Thank you for watching, and if you like this video, please subscribe to help support my channel. Until next time.